Right now, Vermont officials are set to give their latest Tuesday update on the state's ongoing response to COVID-19. Let's go live to Montpelier to listen into AHS Secretary Mike Smith now.
Human Services. Governor Scott is currently on another call with fellow governors and White House officials, but he'll be joining us shortly. Today, I'll start out with an update of our statewide vaccination program, but I want to take a moment and revisit the fact that COVID-19 has affected all of us. For example, for 1 year, every Vermonter has needed to respond to the pandemic in one way or another by wearing a mask or staying 6 feet away from people we care about. We've come a long way in the past year. Today, we have 3 life-saving vaccines available to us and perhaps more to be approved in the future. As I stand here today, more than 1 in 4 adult Vermonters have received at least 1 dose of COVID-19 vaccine. And we are seeing a slow but steady increase in vaccine manufacturing and a decrease in deaths from the virus. This is remarkable and really speaks to how we have been able to really stick together and move toward overcoming the most devastating public health crisis in more than 100 years. Today, I'll provide you with an update on our progress with the statewide vaccination program. In terms of the overall progress, as of this morning, 152,800 people have been vaccinated against COVID-19. 70,100 have received their first dose of vaccine. 82,700 have received their first and last doses of the vaccine. And among those 16 and above with high-risk conditions, 25,400 people have made appointments. I encourage those that are eligible to make an appointment to do so via the state website, healthvermont.gov/myvaccine, or by calling the Vaccine Call Center at 855-722-7878. Moving on, we continue to vaccinate teachers, school staff, and regulated child care programs. And this week we're in now, we'll vaccinate 7,000 individuals in this group through the state program. We are waiting on data from the federal pharmacy program, but we do know that they had nearly 5,000 doses available as well. This week, we have added clinics in Essex County, Franklin, and Orange counties. As a reminder, these groups can make an appointment through the state system when an educator's vaccination clinic has been scheduled, or they can make an appointment at Walgreens, CVS, or Kinney's and bring their confirmation email to their appointment. The state website is healthvermont.gov/myvaccine, which also has a link of the pharmacy's websites. Incarcerated individuals age 18 and over with eligible high-risk conditions will be vaccinated starting this week. We anticipate completing this group of approximately 185 eligible individuals in the next 2 to 3 weeks. CVS pharmacy locations in Barre and Morrisville began vaccinating Vermonters over the weekend. This week, the CVS in Bennington will begin vaccinating Vermonters. As you can make an appointment at CVS locations by visiting our healthvermont.gov/myvaccine website or the CVS website at cvs.com. Other CVS pharmacy locations will begin to schedule clinics as additional vaccine allocations become available through the federal retail pharmacy program. In closing, I want to share that we have a community vaccination site in Beecher Falls on March 29th, and appointments are still available at that community vaccination site. I would encourage you, if you're living in that area, to sign up by going to the state website, one more time, healthvermont.gov/myvaccine, or by calling the Vaccine Center at 855-722-7878. I'll now turn it over to Secretary Young for an overview of the American Rescue Plan.
Good morning. Thank you, Secretary Smith. My name is Suzanne Young. I'm the Secretary of Administration, and today I will provide an overview of some of the key provisions in the American Rescue Plan, focusing on those that will be most immediately available to Vermonters. Just by way of background, the plan was signed into law by President Biden just 5 days ago on Thursday, March 11. I'd like to add my thank you to our congressional delegation for their strong advocacy for Vermont and Vermonters throughout the pandemic. The American Rescue Plan is expected to provide $2.7 billion in state aid. This is the third major piece of federal legislation that provides emergency, individual, and economic relief to the state, Vermont businesses and institutions, nonprofits, and individual Vermonters. The rescue plan brings the total federal relief to Vermont to approximately $7.5 billion since the first month of the pandemic. The American Rescue Plan is a package of aid. Some of it is appropriated to federal agencies to administer, and some of it to state and local governments to administer. In other words, there is some aid that will be provided directly through federal programs and some that will be provided through state programs. There are many details we do not yet have with respect to implementation of some initiatives in the bill. We await additional plan details and federal guidance and rules that apply to a number of the programs funded in the plan. So for clarification, my comments are in no way intended to be a comprehensive or complete review of the American Rescue Plan. But I will begin by highlighting today the provisions of the bill that will bring assistance most quickly to individuals, businesses, nonprofits, and local government. So first, let me focus on some assistance contained in the bill that will get immediate help to individual Vermonters. The most immediate assistance is another economic stimulus payment that eligible taxpayers will receive directly from the IRS. The state has no direct involvement in this payment. This is a $1,400 payment per adult and each dependent for taxpayers with an adjusted gross income of less than $75,000 for single filers and $150,000 for joint filers. The payment will phase out for adjusted gross income above $80,000 for single filers and $160,000 for joint filers. The IRS will use your most recent tax return filed and processed. So if taxpayers haven't filed their 2020 returns, the IRS will or has already used your 2019 return to determine payments. When will this happen? Well, some direct deposits are already pending in Vermonters' accounts, so check your bank balances to see if it has arrived. Checks or prepaid debit cards for others will be mailed by the IRS through the United States Postal Service in the coming weeks. We expect, again, further guidance to be issued by the IRS to address the expected what-if questions, so continue to monitor the IRS website, www.irs.gov. You can also track payment status and apply for a payment if you qualify, but are not required to file a tax return. So again, www.irs.gov/coronavirus/get-my-payment to track your payment and the status of any claim you may have filed. Second, there is a tax exemption that anyone who received unemployment compensation in 2020 should be pursuing right now. The American Rescue Plan excludes from taxation the first $10,200 of unemployment compensation received in 2020 for all taxpayers who have less than $150,000 in adjusted gross income. This is an unprecedented retroactive exclusion and is a very valuable one. And we want to make sure taxpayers are aware and are taking steps to claim the exclusion on this year's tax return. The $10,200 exclusion is a per-person exclusion. So a qualifying married couple could exclude up to $20,400, but only if they each received at least $10,200 in unemployment compensation. Taxpayers will claim this exemption on their federal returns. One of the obvious questions here is, what do I do if I filed my federal tax return before the exemption became effective in law last week? This past weekend, the IRS issued guidance for taxpayers who did just that and advised that if you have already filed your 2020 return, you should not file an amended return at this time, but wait for further guidance from the IRS on how to claim this exemption. For those who have not filed, you should check with the IRS or your tax preparer about how to claim the exemption when you file. There are answers to frequently asked questions about this exemption, again, on the IRS website, www.irs.gov. For this exemption to follow through, however, and apply to Vermont tax filings, the Vermont legislature will have to act and pass a corresponding exemption under the Vermont tax code. The administration is discussing the possibility of including this in a current legislation pending today. So again, for further information, you should check with the IRS about these two immediately available benefits. I'll now just turn briefly to the unemployment benefit payment expansion in the federal bill. The American Rescue Plan extends the $300 federal pandemic unemployment compensation benefit through September 6, 2021. And it extends the pandemic emergency unemployment compensation to that same date, while increasing the total number of weeks of benefits available from 24 to 53. It also provides 100% subsidy of COBRA payments from April 1, 2021 to September 30, 2021 for individuals who lost their jobs and are eligible for COBRA. Now, less immediate but as important, there are a variety of additional tax credit expansions that will help individuals that will be available in next year's filing. That is for the 2021 filing. And just briefly, these credits include expansion of the Earned Income Tax Credit. The Rescue Plan raises the Earned Income Tax Credit for workers without children and lowers the age of eligibility for the credit. Again, this will require the Vermont legislature to provide the exemption to Vermonters. The federal child tax credit in the American Rescue Plan was increased from $2,000 to $3,000 for every child age 6 to 17 and $3,600 for every child under the age of 6. The IRS will also pay out a portion of this credit throughout the latter part of 2021, so again, you should check with the IRS. This is a pure federal tax with no Vermont impact. And then finally, there's an expansion of the Child and Dependent Care credit, which is different than the child tax credit, but is used to offset work-related dependent care cost. This credit was expanded for tax year 2021 and is fully refundable. Again, we will be working with the legislature to pass a corresponding tax credit to Vermont tax liability. So the Vermont Tax Department will keep Vermonters informed of any developments with these tax provisions as they become available, and you should check their website frequently. Turning to some highlights in the Housing and Human Services sections of the Act, there's additional funding for many benefits. We expect individuals to benefit from a number of enhanced or extended programs. Most immediately, the Act includes an expansion of nutrition assistance through the SNAP program, an expansion of the emergency provision of meals to school children for 90 days into the summer, and increased grants for eligible child care providers. For those individuals who are struggling to pay their rent, their mortgage, and utility payments, the American Rescue Plan provides funding for emergency assistance to help with these challenges, as well as an expansion of the LIHEAP Fuel Assistance Program. These programs are all federally funded programs that are administered by the state, so more information will be provided by the agencies and departments who administer those programs. For small businesses and nonprofits, there are several opportunities for assistance in the American Rescue Plan. Many of these will not be administered by the state, but by the Small Business Administration or other organizations, such as banks, but they do include an expansion of eligibility for the Paycheck Protection Program for nonprofits, the addition of funding for targeted economic injury disaster loans, grant funds to restaurants and other food service industry businesses, and funds for the Shuttered Venue Operations Grant Program. Again, as program details become available from our federal partners, we will share these with you. Please pay attention to the website of the Small Business Administration for updates, as well as the website for the Agency of Commerce and Community Development. Finally, there is much opportunity for continued economic recovery contained in an appropriation in the state and local government relief provisions of the American Rescue Plan. The appropriation for state and local government relief totals $1.36 billion, and it is directed to state and local governments. This is similar to the relief provided in the CARES Act last year that created the $1.25 billion Coronavirus Relief Fund that the state was required to spend in the original bill by the end of 2020. There are some significant differences, however, between this bill and the Coronavirus Relief Fund. First, the appropriation includes a carve-out of $191 million for cities, towns, and villages. Because of its size, the City of Burlington will receive a direct payment from the U.S. Treasury of $19 million. The remaining money, in Vermont's case, will go to units of local government, meaning cities, towns, and villages. The state is directed to distribute the money directly to these local governments. Because Vermont does not have county governance, the county share of funds will be divided between the local units of government within each county based on a population formula. This money will come to the state in two pieces. The first 50% is expected this spring, and the second no less than a year from now, or as early as 2022. We have not done the calculations yet as to how much each city, town, and village will be awarded once the county share is allocated and the local units of government within its boundaries, but we will. We do not know when the state will receive this funding, but when we do, we will have 30 days to distribute it to the municipalities with the opportunity to request extensions if needed. But make no mistake, it will be our goal to distribute the funds as soon after its arrival as possible. And we look forward to working with our villages, cities, towns, and the League of Cities and Towns to make this happen. The second notable difference between the money and prior coronavirus relief funds are that the eligible uses of the money are expanded. Not only can the money be used by local governments to respond to the public health emergency, its negative economic impacts, and premium pay, the eligible uses were expanded to include revenue replacement for losses due to COVID and necessary investments in water, sewer, or broadband infrastructure. Another difference from the CRF money is that this time we have nearly 4 years from March 3rd to expend it until December 31, 2024. This means that, with the exception for emergency and immediate needs to respond to the pandemic and its economic impacts, there's some time for local government to thoughtfully plan around the best uses of what we hope will be the bulk of this money pandemic providing. Finally, the state will receive $1.16 billion to spend on eligible uses. Again, the expanded uses mentioned previously also apply to the state. We expect all but $113 million to be delivered to the state in either one or two pieces. While we know with certainty from the language of the Act that we will only receive 50% of the money for local governments this spring, the Secretary of Treasury has the discretion to send the state its entire amount, or at one time, or to hold some back for at least a year. We do not know yet what the decision will be for Vermont or when it will be made. The remaining $113 million has been set aside for critical capital projects. The state will have to apply for this money, and there's no guidance or application process stood up yet. What we do know is that the projects proposed must be critical to directly enabling work, education, and health monitoring, including remote options in response to the COVID emergency. Again, as with the local money, and after emergency immediate needs are taken care of, there's much opportunity to be thoughtful in our approach to spending this money in a way that benefits Vermont and its economy in the long run. This state and local money provides some meaningful opportunities to continue to build out broadband in our state. The ability to use some of the state and local money for broadband infrastructure, coupled with the governor's proposal to use one-time surplus this year in the legislature, pending in the legislature, plus federal money that may become available through the Emergency Connectivity Fund created in the American Rescue Plan, will get us much closer to achieving our broadband expansion goals. So I'll conclude here with the acknowledgement again that I have just scratched the surface of the details of the $2.7 billion American Rescue Plan. There are many details still to learn, federal guidance and rules to be issued, and conversations with the legislature to be had about the path forward to spend the relief money in the most strategic way to put all of Vermont on a solid economic foundation for the future. We will keep you informed every step of the way. I will now turn this over to Commissioner Piszak.
Thank you very much, Secretary Young, and good morning, everybody. Today I want to start with an overview of the single greatest item that's impacting our COVID-19 data and certainly impacting our outlook, which is the number of Vermonters who have been willing to be vaccinated to date. For the past year, we have all wondered when the pandemic might end, and quite simply, this chart here holds the key. The higher these percentages go, the faster and more normal our recovery will be. And so far, the uptake among our most vulnerable populations has been impressive. More than 84% of our 75 and older population has started or completed vaccination, higher than the national average, which is closer to 71%. The percentage of the population 70 to 74 who have started or completed their vaccination increased 25% this week and now stands at over 80% as well. And the percentage of the 65 to 69-year-olds nearly doubled this week and now stands at 50% who have either started or completed vaccination, with thousands more scheduled to get the vaccine in the days ahead. And even though Vermont is one of the oldest states in terms of the percent of its population over 65, we are one of the leading states in terms of the vaccination percentage among this population. And we're seeing the direct impact in our data, and these early uptake percentages indicate a strong performance and bode well for Vermont in the weeks and months ahead. Looking at Vermont's vaccination progress, this week we administered over 7,000 vaccines on a single day, which was the highest that we've done since the start of the program. And our 7-day average is now over 5,000 daily vaccines administered, a 20% increase compared to last week. This week we'll report 791 new COVID-19 cases, a reduction of over 100 cases when compared to last week. And also today, Vermont passes the 17,000 total case threshold, which still represents the lowest aggregate number of cases in the country and the second lowest per capita numbers in the country since the start of the pandemic. You can see that the 7-day average has been coming down from where it was last week, standing then at over 130 cases on a 7-day average, and is now back down to 108 cases on that average. Again, we can see that the COVID-19 outbreak at the Newport prison contributed to the rise in cases over the past 2 weeks, and without that outbreak, our 7-day average would have been more stable. Looking beyond these top-line case metrics, we continue to see encouraging signs in our data. First, over the past few months, we have seen a gradual and steady decline in the median age of an individual contracting COVID-19 in Vermont, down from 44 years old at the end of November to 32 years old today. Our median age is getting younger because fewer vulnerable Vermonters are contracting the virus. Looking at long-term care facility residents, you can see that the increase in infections that we saw from November through January has now significantly decreased, with our statewide numbers continuing to remain high. In fact, we've only reported 6 long-term care facility cases in the last 3 weeks and have just 2 active outbreaks. And these active outbreaks are considerably smaller when compared to outbreaks we were experiencing in long-term care facilities earlier in the year and last December. Looking more broadly, the 70-year and older population continues to see fewer cases on a per capita basis compared to the under 70 crowd. And we anticipate that the 65 to 69-year-old population, since they're standing now at about 50% who have started or completed vaccination, and that percentage is increasing quickly, we anticipate to see fewer cases among this age group also in the weeks to come. Turning to college cases, we see that we're reporting 59 new cases this week, which is pretty much in line with the weekly numbers that we've seen so far this spring semester. The Vermont case forecast continues to remain stable, with the short-term projection anticipating that cases will remain on average around 100 per day, but the longer-term projection indicates that cases will start to decrease over time, and this longer-term projection incorporates the increase in vaccination that we'll see over time and anticipates cases will start to fall toward the beginning of April and fall again more rapidly throughout that month. Turning to Vermont's hospitalization metrics, we continue to see fewer people on average in the ICU with COVID-19, which is certainly an encouraging sign. At the same time, however, we are seeing that hospitalizations generally have flattened out over the past week, with us averaging between 25 and 30 individuals in the hospital statewide. Again, we do anticipate this number to fall as we make further progress vaccinating those with underlying conditions and those in their 70s and 60s and younger. Looking at our COVID-19 death forecast, we are still fortunately seeing favorable indicators. As I mentioned, the number of cases at long-term care facilities is down. Cases among the 70 and older population is also down. And we're trending down in ICU and ventilator usage as well. With these indicators still trending favorably, our most important metric, the number of deaths in Vermont, is anticipated to continue to improve. 8 Vermonters have died so far this month, but we anticipate that this will end up being a step down in March compared to the numbers we have seen in previous recent months. Taking a quick look around the region and the country, we see that the Northeast is essentially reporting the same number of cases this week as it did last week, with a very small decrease. Comparing the Northeast to the rest of the regions in the country, you can see that we are experiencing higher case counts over the past 2 weeks compared certainly to the South and to the West, and that we've also had basically flat growth during that period of time. However, our other regional metrics continue to improve, including the positivity rate, hospitalization rate, and most importantly, the fatality rate. Regional forecast indicates that cases are anticipated to continue to decline across the region as more and more people are vaccinated and as the weather continues to improve. Again, all of which is good news for Vermont. Finally, looking at our national numbers, we see that cases have continued to decrease, albeit slowly, down 8% over the last 10 days. And national hospitalizations and deaths are also continuing their decrease, with hospitalizations down 8% over the past 10 days, while deaths have decreased over 21% during that same period of time, again indicating that the most vulnerable across the country are also getting that benefit of the protection of the vaccine. At this time, I would like to turn it over to Dr. Levine.
Thank you, Commissioner Pieciak. Our cases do indeed continue to be reported in a fairly steady range, anywhere from 50 to 80 to 130 to 175 cases a day. Today, we are reporting a slight downtick in the hospitalizations to 24, 3 patients in the ICU, and a positivity rate 1.3%. I'm focusing on the range of cases for a couple of reasons. One, because we know that one day's report does not reflect a trend, and two, because this has been and is expected to be the reality over the next several weeks before we see that drop towards the end of the month. We've made great progress in vaccination so far, with more than 26% of Vermonters vaccinated, but it will take some time to see an impact on COVID-19 cases as our vaccination program ramps up with more doses allocated and more Vermonters protected. What's important is that we are seeing fewer cases in our older age groups, as you just saw. Large portions of those groups have now been vaccinated, so there's far less risk of severe illness, hospitalizations, and death. Ultimately, we would hope to see the same benefits for those with high-risk conditions and those in the next age bands as well. Now, one of the things I've been talking about with vaccine is that no matter what level we record the efficacy at, anywhere from 66 to 95%, the greatest benefit you should be watching for is the vaccine's efficacy in preventing serious illness, hospitalizations, and death. Just what we're seeing in Vermont. Perhaps you might still get mild illness. This is how many vaccines work, including the flu vaccine. Well, recently published evidence shows there's much less likelihood of having an asymptomatic infection as well. For patients presenting for COVID testing through the PCR test and the nasal swab prior to a procedure, those who were vaccinated with at least one dose of COVID-19 vaccine had a 56% reduction in positive PCR results. And after 2 doses, the effect was even greater, an 80% reduction. The authors stated that these results are consistent with previously published data showing a reduction in asymptomatic infection following vaccination with an mRNA vaccine, even after 1 dose. The other topic I'd like to talk about today is the variant strains. We've just received more results from last week's submitted specimens for whole genome sequencing, which is used to determine whether variant strains are circulating. From those results, we found 4 more positives for the B117 UK variant strain, giving us a total of 5 now in the state. Not unusual, I should add, when you look across the country. As we've said before, the discovery of these variants should really drive us all to more strongly adhere to the prevention steps we're already taking. Remember, masks on faces, 6-foot spaces, uncrowded places. Perhaps take a look at your mask to see if you can get a better fit, or even double mask. The CDC website will show you how. Or if you're visiting somewhere with a lot of people, come back later when it's less crowded. And as always, if you don't feel well, stay at home. The choices that we make can make a big difference for ourselves, our loved ones, and our communities. The variants of concern we found here make the virus spread more easily from person to person, and we need to do everything we can to stop that spread, to reduce the chances for additional mutations and strains. Fortunately, these variants have not had serious impact on health outcomes, hospitalizations, or deaths at this time in the United States. However, there is now peer-reviewed information published in England on the UK B117 variant, which does provide the first indication that this variant may be more deadly, but according to the study, only minimally so. Though the headline states a 64% increased risk of death, when one looks at the absolute risk of death, it only increased from 2.5 to 4.1 deaths per 1,000 cases. So while I want you to be cautious and follow all of the public health guidance, I also want you to put this information in perspective. In the US, even with variants being detected, we are seeing decreased hospitalizations, deaths, and no surges or reinfections. All of this is why we can take deliberate steps towards reopening. If we can limit the amount of virus that is circulating in our communities, stay ahead of community spread, get tested if we have symptoms or think we might have been exposed, we can get through this critical stage together until we all have that chance we've been waiting for to protect ourselves and each other through vaccination. Since the governor is not yet completed with his call, we'll begin the media part of the conference now.
Start with Calvin.
Probably a question for Secretary Smith, maybe yourself too, but last week you mentioned that the state is soon going to be standing up clinics for BIPOC Vermonters and their families. I'm wondering just first off, what information you can share, whether we have any details of when these will be, where these will be, and which vaccine will be given as well.
Yes, so to start with, I believe we're having one today actually. Perhaps if not today, it's within the next day or two in Burlington. There's another one being scheduled for next week in Addison County. And there are several others that are still in the planning stage, and I can't give you the exact date. The vaccine that's being used is the same vaccine most of us can all get because it's the one that's available, which is the mRNA vaccines, Pfizer and Moderna. And was that all your questions?
Yeah, and then so you mentioned that, in the past, getting word out to a lot of BIPOC Vermonters, you reached out to community leaders and other people as well. I'm wondering, how that's been and, whether you think that the right people are hearing this messaging from the state.
Yeah, good. So obviously there's the one methodology, which is just look at our website, because I promised people that there will be information on there in a timely way. The second, though, is through our community partner organizations who are helping us work with the BIPOC community itself to inform them of the opportunities that are available. So they're helping us in the beginning provide those opportunities, if you will, and set up the clinics, and they will also be working to provide the community with a notion of where and when it is and make sure they get signed up.
I might have one just quick follow-up if you don't know if possible.
Sure.
This one may be for Mike. On the housing for the homeless folks, where are we at with that? We've had several instances of problems, especially up here. We hear mostly about the problems at the inn at the top of the hill here in Berlin. Last week, getting a little bit more serious with a fire and a woman being pretty critically injured. Frustrations, or where are we at with that?
Well, as you know, Steve, at the start of the pandemic, we made a commitment to sort of make sure that we house those that were homeless, and so we expanded our hotel motel program, and we're housing approximately 2,500 individuals now. Those are adults and kids into hotel motels across the state. We have to transition as we come out of this emergency. We're going to have to transition to another program, and we're looking at that right now. I had a meeting with committee chairs of the money committees the other day. We're looking at forming a working group so that we can all come to consensus of what that's going to look like as we move out of out of the emergency. So I would say stay tuned for the details. I mean, we had a plan that we had submitted. I think it ran into some opposition at the legislative level. We're trying to work this out now. But I think you're going to have to see three components out of this plan. You're going to have to see permanent housing. You're going to have to see more shelters. And you're going to have to see, as we started this program, we took off the limits to, or the various qualification eligibility limits that we had on the program. We're going to have to we're going to have to bring those back in. What they look like, we'll work out with the legislature on, but certainly we're going to have some sort of criteria as we move forward. So those are the three things we're working. We met yesterday. We said we'll form a working group and try to have something before the end of the session, so that, and the timing will work out too, because about that time, you know, the vaccination program should be really rolling along, and we should be really starting to look at how we exit this and how we exit this program.
Is there some sort of a law enforcement component that should be put into this thing as far as, you know, keeping other people in the buildings that you're housing and being safe?
We have a security component that we spend quite a bit of money on at these facilities. We're looking at what happened in Berlin and seeing if we have to beef up something there in particular. It's been very discouraging of what happened there, and we just got to figure out where we move forward with that facility and where we move forward with the program in that area.
Moving to the phones to Stewart, NBC5.
Thanks. Good morning. I want to ask a question forwarded to me by a manufacturing facility in Franklin County who asked a pretty good question. They were saying they are diligently following the most recent return to work guidance, but that was provided last May and seems outdated given all of the changes that have occurred with the state's approach to COVID since then. So the question is, when can the manufacturing sector in Vermont expect an update on return to work guidance that they have been operating under since, you know, last spring?
I'll turn to ACCD for that.
You bet. Hi, this is Secretary Curley. Thank you for the question. Yes, you know, our teams have been, there's been many sectors actually that have been sort of in the same posture for a really long time. And our team's been busy working with the Department of Health and the Department of Public Safety to identify how we're going to come out of this crisis in the next few months. So you've probably heard the governor talk about mentioning a plan for exit and something that, you know, he hopes to roll out in the next few weeks. So they can expect to see more information, I would say, sometime in the next few weeks on a change of posture.
Okay, so in the works. Speaking of returning to work, will bartenders be returning to work, or are you waiting, Secretary O. Smith, until after St. Patrick's Day?
We're, again, you know, we're trying to, you know, as Dr. Levine has said, conditions on the ground in March are still very concerning. And so we're just waiting until we have a little bit more time under our belt. But you're going to be, again, hearing more about bars in the very near future.
All right, thank you very much.
And the governor is here, so he will go ahead and deliver his update, and then we'll get back to the Q&A.
I'm sorry I missed Stewart's question. But, good morning, everyone. I just got off from our 8th call with fellow governors in the White House, and we did hear some positive news. This is the first update we've received since the president's speech last week, where he said that all Americans need to be eligible to register for vaccination by May 1st. As I said last week, we have a schedule mapped out that not only meets this goal, but could exceed it. But this is 100% dependent on the supply from the federal government. It's one thing to say everyone is eligible, It's quite another to have the supply to actually get shots in arms. And as I said, if we get the doses we need, we'll exceed the goal. So here's what we heard today. First, we were updated on the supply. So this week and next week, Pfizer and Moderna will increase to 16 million nationwide for the state supplies, which will mean an increase of about 550 doses for Vermont. The federal pharmacy program, which is that's their direct supply to the pharmacies, will see a 100,000 dose increase of Pfizer and Moderna, and 150,000 of Johnson & Johnson, which means roughly another 250 doses for us. They also allocate 400,000 Johnson & Johnson doses this week, which is good news because we didn't expect any last week. They had told us that we would not be receiving a supply of Johnson & Johnson. So these increases means a total of about 800 additional doses for Vermont next week. And they said the following week that it would be flat. So the good news here is it won't be a decrease. But beginning the week of March 29th, Pfizer and Moderna, this is what they expect, will be in the 16 to 17 million range, and we'll also get into a steady flow of Johnson & Johnson with 4 to 6 million a week by the end of April, 6 million by the end of April. So it'll start off around 4 million. So that equates to an increase of about 4,000 to 5,000 doses for Vermont. So in April, we were told national allocation of all doses should continue to increase as time goes on. So this is the assurance we've been waiting for, and we'll use this information to update our projections, and on Friday, we'll announce when our next age band, 60 plus, will open. And with these assurances on supply, I'll also be able to outline the full schedule for all remaining age bands in order to accomplish making every Vermonter over the age of 16 eligible by the end of April. Or by the end of April. And again, I want to remind folks, this doesn't mean that everyone will be fully vaccinated by May 1st. It just means they can sign up. That's what the president had promised, and that's what we believe we can deliver on and possibly exceed. But as you'll see, if supply comes in as promised, we hope anyone who wants a vaccine will have the opportunity to be fully vaccinated by the summer, which will allow us to get back to normal, I believe back to normal by the 4th of July. In the meantime, as you've heard from Dr. Levine as well, while we make progress through vaccinations, it's as important as ever to continue following basic health guidance. We need to get through this as we vaccinate others, which means wearing masks, keeping your distance, avoiding crowds, and also getting tested, which is still a really important tool for us here in the state. So with that,